Good afternoon, everyone. My name is Chrissy Matheson, and I'll be your moderator for today's press briefing. Before we begin, I'd like to introduce the Premier of Nova Scotia, Dr. Robert Strang, the Honourable Iain Rankin, and Nova Scotia's Chief Medical Officer of Health, Dr. Robert Strang. Go ahead, Premier.
Thank you. Good afternoon, everyone. We're reporting 3 new cases today, 2 in the central zone, 1 in the western zone. That gives us a total of 24 active cases in the province. Today, on the eve of Easter weekend, I'm pleased to share with you that we've hit a milestone of over 100,000 doses in arms. That's more than half of Nova Scotians over the age of 80 now receiving their vaccine shot, and over 85% of healthcare workers now have their first shot. We're well on track to meet our target of delivering a first dose to every Nova Scotian by the end of June. We had a record high once again on Tuesday with 6,200 doses in arms. As of today, we are adding Nova Scotians over the age of 70 to be able to book their appointment to get their vaccine. There are still appointments available in different locations like the one behind me at the Halifax Forum. New appointments for the weeks of April 12th and 19th have also been added, and 27 pharmacies will be operating next week with the new shipment of Moderna next week. There are many opportunities for Nova Scotians to get their vaccine, and we're adding more and more appointments as we get more supply. The first outreach clinic was now operating in Halifax. A mobile van went out to deliver 200 shots yesterday to the homeless population and supports, and I'm hearing it's going very well. We're also making great progress in our long-term care sector. By the end of this week, all of our licensed long-term care centres will have received their first dose or have the vaccine on site. And then all the staff and residents of our private long-term care homes and residential facilities will get their first dose by the end of April. We are making good progress. However, if you see what's happening in other parts of the country where they have tighter restrictions and in some cases lockdown, we can be thankful that Nova Scotians continue to work hard following public health protocol, and as long as that continues, we'll continue to be in good shape as we await for our vaccine supply. Thank you, and I'll now turn it over to Dr. Strang.
Thank you, Premier. Good afternoon, everyone. As the Premier said, our epidemiology remains low and stable, and that is good news given what is happening in a number of provinces across the country. We have seen some variant cases popping up, and those always create additional concern because we've seen how quickly the variants can spread in other parts of the country. But so far that we've been fortunate that we haven't had any community spread associated with our variant cases. We did organize a temporary testing site and increase capacity at local primary assessment centres in response to recent variant cases in Lower Sackville and Kings Wharf apartment complex in Dartmouth. And the goal, as always, has been when we have these kind of little small clusters in the community to do widespread testing in that area to ensure that we're not missing any cases. And we haven't detected anything to date. And our testing numbers have increased significantly over the last number of days as a result. And so I thank people who have heard our call for testing and have come out, and our testing sites have been busy. And the lab has done well over 4,000 tests in each of the last 2 days. And I was talking with them this morning, and they have already had another 4,000 tests ready to process today. And excuse me. And despite all this increased testing, we're not seeing increased case activity, which is really good news. So I want to thank everyone who came out to get tested. This approach that we continue to use is how we work together to contain any potential spread of COVID-19 here in the province. And I also want to say thank you to once again to the Nova Scotia Health Authority lab for their work at processing building capacity. And they've also now developed a process to pre-screen for variant cases. This test can give an initial sense of whether a positive specimen is a variant. It can't identify which variant, but it does give us same-day results. And then all the positive specimens through the screening test are then sent to the national lab for confirmation of variants, and that can take up to 1 to 2 weeks. But the benefit is that if we can pick up a possible or a variant case early, and we can add that to our public health response as we're dealing with those cases. So I'd like to move on just to talk about vaccines quickly. As the Premier noted, booking is now open for Nova Scotians age 70 and older. And if you have not yet booked yourself or for a loved one, please do so. There are appointments available all over the province, and we will keep adding additional appointments as required. Today is the last day that clinics are running for our initial doses of Astrazeneca. Appointments were fully booked for the initial 13,000 doses of this vaccine. And I hope that this continues as we get more of the Astrazeneca vaccine available. We have confirmed a shipment of Astrazeneca vaccine next week, 38,800 doses. So starting Tuesday, April 6th, Nova Scotians aged 55 to 64 years of age can book an appointment to get the Astrazeneca vaccine. So we're expanding from the 60 to 64-year-olds and adding on the 50 to 59-year-olds. Starting next Tuesday, they can go, that age group can then also, if they choose, can go and book an appointment for Astrazeneca vaccine. I do understand that if people have concerns about Astrazeneca vaccine based on what they're hearing in the media, but I want to assure Nova Scotians that if we didn't think that this vaccine was safe, and if Health Canada did not believe that it was safe, it would not be part of our vaccine program. But I do want to repeat some of the messages that I delivered on Tuesday as well. The pause on the use of AstraZeneca for people under age 55 doesn't mean that the vaccine isn't safe or isn't a good vaccine. It means that we're seeing something rare in a certain subset of the population that we need to monitor and get more information about. Anyone over 55 can still get this vaccine if given the choice, as the benefits of getting the vaccine substantively outweigh any potential increased risk. The benefits of the vaccine outweigh the increased risk that COVID-19 poses to the older adults. I also want to remind Nova Scotians that even if you've been vaccinated with 1 or 2 doses of vaccine, you still have to practice all the public health measures, including wearing a mask. I'm hearing reports of people who are out and about without a mask because they've gotten the vaccine. And as I've talked about previously, we still don't yet have definitive information that would say that you don't have the chance to be asymptomatically transmitting the virus after you've been vaccinated. So until we get higher levels of vaccination and get more definitive evidence on a very low risk of asymptomatic transmission, continued public health measures after vaccination is important. This is a topic of discussion, very active discussion among the Council of Chief Medical Officers of Health, and we hope that in the near future we'll be able to give a different answer. But for now, vaccinated people still have to follow all the other public health protocols. In closing, I'd just like to give a message to any children who may be listening. I hope the Easter Bunny visits you this year and brings you some chocolate, but not too much. I already got some chocolate here at my table, so I'm happy. If you want to help the Easter Bunny, you could leave out some hand sanitizer so he can clean, or he or she can clean their hands when they come to visit. And remember to wash your hands as well before you eat, and if you're playing before you play with friends. And whether you're a child or an adult, your actions can help protect your friends, family, and community from COVID-19. That's why it's so important to get vaccinated when your age group becomes eligible. It adds another layer of protection from COVID-19. And by doing so, we are caring for yourself and caring for others. And I do want to end by thanking all those who will be working in a vaccine clinic, at a testing site, in the lab, or in a public health office this weekend. And I wish everyone a safe and happy long weekend.
Dr. Strang, we'll do one question and one follow-up in the time that we have for today, starting with Lindsay Armstrong with All Nova Scotia.
Thank you. Dr. Strang, I'm guessing you're within that 55 to 64 age category. I'm wondering if you will be signing up for the Astrazeneca vaccine.
So we have a limited amount of that vaccine. Thank you for judging that. I'm actually older than that. So I'm in the 60 to 64 category, but I appreciate your comment. I know that I looked at that. We even though with the 38,800, that's only enough for 25% of the people who are in. There's 155 1,000 Nova Scotians in that. I'm eligible as a healthcare worker, and I'm going to be signed up to get vaccinated as a healthcare worker because there are many Nova Scotians in the 55 to 64 category who want to get vaccinated. We only have enough vaccine for 25%, so I'm very happy to let the vaccine go to those and not take up one of those spots. I have other vaccine that is available for me that still leaves vaccine available for those limited numbers, the limited percentage that we have the Astrazeneca for, and they can get immunized earlier than they could waiting for their age group.
Go ahead with your follow-up, Lindsay.
Recognizing what you've just said about the importance of vaccinating as soon as your time slot becomes available, what would you say to those who are maybe a bit concerned about AstraZeneca and who are now hearing that you're going to wait for something else for yourself?
So I'm not waiting. I have an option that because I'm a healthcare worker, I can get in a line for the healthcare worker. If I wasn't, I could choose AstraZeneca. But because there's only, as I said, there's AstraZeneca for 25% of the eligible cohort. So if I take one of those, when I have another option, there's somebody in that age cohort who can't get a vaccine. So I'm going to go a different route and leave all that vaccine open for those who that is their only option for vaccine at this time.
Next question will go to Blair Rhodes with CBC.
Dr. Strang, earlier in this news conference, you indicated, or I believe perhaps the Premier did, that there were openings still available for vaccinations at various clinics. Why are there still openings? Are you seeing or hearing of any hesitancy out there?
No, we have openings, but that's for the next week or 2 weeks. So we open up 2 weeks at a time. They don't all get filled up right away. So that's why we continue to message through social media, through briefings and stuff, encouraging people to come out and get vaccinated. But we know that, based on the last number of weeks, that those will fill up. We are not having unused appointments. It is, people may not be filled up immediately. But by the time that slot becomes available, whether it's next week or the week after, we are not seeing clinics spaces sitting around unused.
Go ahead with your follow-up, Blair.
Okay, the reason I ask that, of course, is that we are seeing that in places like Toronto, where there have been vaccine clinics where they have openings and they can't seem to persuade people to come out.
Well, I mean, we've invested in an online booking process. That part of that is the reason to do that is we have a lot of control on the flow of people, and we manage folks. And if we're seeing gaps, so for instance, when we see gaps in a certain clinic in a community, we're reaching out through local radio stations and other mechanisms within that community to make sure we get those slots filled.
Next question will go to Elizabeth McSheffrey with Global.
Yes, Dr. Strang, I'm wondering if you can give me a sense of the time difference if somebody in the right age group for AstraZeneca decides to pass on the opportunity to get the vaccine now. How much longer do you estimate they would wait to get a different vaccine?
Yeah, based on our modeling and our projections on supply that we presented, it would be at the end of April that the 55, I just looked at this morning, the 55 to 59-year-olds, if they choose to wait for an mRNA vaccine, they're waiting essentially a month till toward the end of April.
And my next question pertains to rotational workers. I'm wondering when you predict they'll come up as part of a phase 2 priority group, and if Nova Scotia will take a similar approach to New Brunswick, which is that once those rotational workers are isolated, 14 days later they won't have to quarantine anymore when they're coming back.
So two things. The phase 2 that you're referring to, that was developed when we were anticipating not being able to get everybody their first dose until September. And we recognized there were some occupational groups that we had to make a priority. Now that we know that it's first dose into everybody's arms, and where every adult can get a vaccine by mid to late June, we don't need to prioritize that. They can get. There's no advantage of making them saying rotational workers as a group. They can slot in as their age groups become eligible, because that will be the fastest way they get vaccinated. On the question around New Brunswick, we still don't have any science that if you're immunized that you can't still be an asymptomatic spreader. And so when I asked New Brunswick about what is the evidence behind their loosening up, they say we don't have any evidence to reassure ourselves that they're willing to take a risk to accommodate a bit more freedoms for the rotational workers, recognizing that the requirements for their rotational workers, they're under a strict quarantine, whereas all along we've had a modified quarantine for rotational workers where they can be out in the community with their families. So, but they are taking a risk by allowing those workers to come out of their quarantine early, even if they're vaccinated. As I've said many times, we still don't have the most definitive evidence that they couldn't still be asymptomatically spreading even if they're out of their quarantine.
Next question will go to Tim Biscay with the Halifax Examiner.
Dr. Strang, I guess I want to get in the weeds a little bit with numbers for vaccinations. You've said that any vaccine received 1 week will be administered by the end of the following week. Doesn't seem to be quite on track for that. Are you still comfortable with that?
Well, it's within the week to 2 weeks. So we don't get vaccines. Some vaccines, some weeks we get every week. Other vaccines, it'll be 2 weeks. Like the Moderna is not as frequent. So what we do is when we get a shipment of vaccine, when people look at the numbers, what they're not seeing is we have to have an inventory. What is driving our clinics for this week and next week? We have a supply. We don't have just-in-time delivery. So when people look at numbers and they say, well, you've got a whole bunch of vaccine that's unimmunized, well, that's actually our inventory to drive anywhere from 1 to 2 weeks until our next vaccine supply. And when we do get a supply of vaccine, it comes centrally. It has to be broken down, if you will, into smaller allotments and then distributed out to various vaccine sites. So basically that takes a few days to do that, and then the next week it starts to get delivered.
Go ahead with your follow-up.
Nursing homes. You said, the Premier said that 85% have been received their first shot. There was some urgency on that. It still feels, what's holding back the 15%?
So I'm in the process now. I was just looking at this morning. Within the next couple of weeks, we'll have all of our licensed long-term care facilities having first dose of vaccine, and then through April, there's a lot of private seniors residential facilities. They're not licensed long-term care facilities, and that's going to be our focus through the month of April.
Going to the phones. First question will go to Natasha Pace with CTV.
Thank you. Dr. Strang, I'm wondering, you mentioned the 38,000 doses of Astrazeneca we're expected to receive next week. Are there any other shipments of vaccines scheduled for Nova Scotia next week?
Not that I'm aware of. No, we're getting Moderna. We got Moderna this week, and we're getting the AstraZeneca next week.
Go ahead with your follow-up, Natasha.
Thank you. Premier, I'm just wondering if you could update us on the Atlantic bubble and whether or not that's still a go, given what we're seeing in Nova Scotia, what we're seeing in New Brunswick. And is April 19th still the target date to have that up and running?
So far, April 19th will be the date. We continue to monitor New Brunswick on a daily basis, and so far that outbreak has been contained to the Edmundston and surrounding communities, so that's why our advisory is in place. We'll make adjustments quickly if there is further developments with New Brunswick, but Newfoundland's been doing really well, so I've engaged discussions already with Newfoundland. We might be able to do something there sooner.
Next question will go to John McPhee with the Herald.
Thank you very much. This is for Dr. Strang. We heard from people who couldn't book their AstraZeneca shot after trying for a week in the first phase of that rollout. Will the booking system be adjusted to accommodate the additional people who can now get the shot?
So anybody, once you're eligible, so if they, for some reason, and I don't know the technicalities, the vast majority of people are able to book their clinic appointment very successfully. Excuse me. I got a dry throat. Once they're eligible, and when we're opening up those, even if they tried for the 13,000 and weren't able to get in there, they're still in that age group of 50 to 64, so they're still eligible and can rebook a vaccine now that we have additional coming.
Go ahead with your follow-up, John.
Thank you. This is again for Dr. Strang. Pfizer said, I believe it was yesterday, they said that a study shows that their vaccine is effective is quite effective in the 95% range, I think, in the 12 to 15-year-old category. Do you think that this age category will be added to Nova Scotia's plans at some point?
So that's a single study from the manufacturer. They would have to bring that forward for assessment by Health Canada, and Health Canada would adjust the license if the evidence was there. That has not been done yet, so we can't act independently. We would have to wait for Health Canada to license that product for this younger age group.
Next question will go to Heath Doucette with Canadian Press.
Good afternoon, Dr. Strang. I'm wondering if there's still anybody hesitant about taking Astrazeneca, whether you can offer even further assurances. I know that there's been U.S.-based doctors who said at the very least all 4 vaccines will at the very least keep you out of an ICU. Is that your understanding about all the vaccines, including AstraZeneca? Is that yet another reason why people should consider taking it if they're hesitant?
Yeah, I mean, everything I've seen, and I haven't seen Johnson & Johnson as yet to be licensed here in Canada, so even that data hasn't even come forward through Health Canada to the National Advisory Committee. So the 3 vaccines that I'm well aware of are AstraZeneca, Moderna, and Pfizer, and all the evidence is that they're all very effective against presenting severe disease requiring hospitalization or even ICU admission or even death. So I'm very comfortable, and that is the reason one of the reasons we're making the recommendation that for people 55 to 64 that they're still comfortable, because their risk of a severe outcome from COVID starts to become a much bigger factor, and certainly far outweighs any very small risks from what we know of these blood clotting events, which all seem to be happening by and large in the under 55s. So that's why we're still going ahead very confident and comfortable that the AstraZeneca is safe to recommend for that 55 to 64 year age group. And NACI, however, above 65, NACI still has the preferential recommendation that people who are at groups that are at significant increased risk of severe outcomes from COVID should preferentially receive the mRNA vaccine, and that's why we're sticking within that 55 to 64 year age group, and above 65 for AstraZeneca, and then above 65 we're continuing to roll out the Moderna and Pfizer vaccine.
Go ahead with your follow-up, Keith.
And I'm just wondering, on the off chance that there's not the required uptake of the AstraZeneca, are there any plans for what you might do with that vaccine, or do you need to even make any? I'm just wondering about that.
We know that the vaccine, I know the specific date, but it has a much longer shelf life, a very different expiry date than the initial allotment, that 13,000, it expires tomorrow. So we'll monitor the uptake, and we'll see where we're at with disease, with vaccine supply, all different vaccine supplies, as well as the uptake of AstraZeneca. And we may get much more information. I fully expect that this issue around this specific blood clotting event, we're going to get more information in the next few weeks, and then all of that will factor into how we can continue to use AstraZeneca moving forward.
Next question will go to Victoria Walton with The Coast.
Thanks. This question's for Dr. Strang about vaccine clinics. And just in terms of people being able to book weekend appointments, we heard back from Public Health that this past week, for example, Friday there were 22 different clinics open. Saturday there were 13, and Sunday there were 4 across the province. And I'm just wondering, as we move into the working population, and I mean people over 65 and 70, some of them are certainly still working as well, will we be increasing vaccine appointments available on the weekend to be the same as weekdays?
Well, as we get more vaccine supply, it's not just 9 to 5. We have vaccine clinics early in the morning. We have vaccine clinics in the evening, as we get more vaccine supply, we'll be having more time available even on weekends.
Go ahead with your follow-up, Victoria.
Thanks. And I know there was a release sent out last night saying that there were, still some appointments available next week for some areas, some rural, even in Halifax. And then we opened it up this morning to the 70 and older. I'm wondering kind of at what point do we move on to the next age group? Like, do we wait for every 70-year-old to sign up before opening the next one, even when there are appointments available, or are we trying to do this faster and faster and opening up more age groups now?
No, we'll give a reasonable amount of time, as we've done all along. We're moving, and we're actually opening up to the 70-year-olds a week ahead of schedule. Some of that is just the things are moving. The clinics are moving faster. Some of it is we're absolutely right. We're not going to wait to get every last person in an age group before we open up to the next age group. But once your age group is eligible, you can go on and book, even though we're adding younger age cohorts into becoming eligible.
Next question will go to Jean Laroche with CBC.
Good afternoon, Dr. Strang. You mentioned earlier as a health employee you're eligible for a vaccine outside your age group, and I want to make it very clear, I do not begrudge you or anyone else getting the vaccine that way. However, hospital employees who are not in contact with patients, don't work on the floors, and in some cases have been working from home, are getting their vaccine ahead of others who are at a higher risk. And so can you square the circle for me and tell me why that makes sense, given the fact that the province has decided as a hard and fast rule we are vaccinating based on age rather than risk?
So what the health authorities are doing, they're saying anybody who works in the hospital or healthcare facility who could have direct contact with patients is eligible right now, as well as community-based healthcare providers like physicians, dentists. But what they're also doing is that when they are running their hospital-based clinics, because our healthcare worker clinics are still in those hospital-based facilities that we started out at, if they come towards the end of a day or they have somebody who things can happen in healthcare that for lots of reasons somebody all of a sudden quickly it becomes not available, they have a process that they can bring other people in who are on site. So it may be that there's a small number of people who who don't have the potential to be directly in contact with patients that have been immunized. It's far better to provide vaccine on short notice to them than to waste that vaccine.
Go ahead with your follow-up, Jean.
My understanding, Dr. Strang, is that there are these employees, hospital employees, who don't have contact with patients who are being scheduled for vaccines. And I just wondered how that makes epidemiological sense given our policy.
So that's not my understanding. What the health authorities are doing, their language is very clear that healthcare or anybody who works in the hospital facility who may come into direct contact with patients. So that includes people that are, cleaners, people that are delivering meals on the floors. Those are the groups that are focusing on now. And there may be some others that, because of the need to use vaccine rather than waste it, who aren't in that category, get immunized.
And that's all the time we have for questions today. Go ahead, Premier.
Thank you, Chrissy. As you know, this is holiday weekend, and I hope you all get to spend it with friends and family. Looking across the country, we are very fortunate to live where we live. I think an Easter long weekend in Nova Scotia will look different than a long weekend in provinces where they continue to battle outbreaks of COVID-19 and new lockdowns are being imposed. As Dr. Strang says, things can change quickly, and it's up to us to keep one another safe. I want to close with a request. If you are eligible to book and haven't, please take that step. It's critical that every Nova Scotian who is able gets the vaccine. This is our way forward, out of the pandemic and back to normal. And if you're wondering whether clinics are open this weekend, as was asked today, they are. Over 5,000 Nova Scotians are getting vaccines this weekend. Thanks to all of them and to the staff and volunteers, like those shown behind me, for giving up their weekends to help keep these clinics running. As Dr. Strang suggested, leaving some hand sanitizer out for the Easter Bunny, may I suggest that you also leave out some carrots. Have a safe and happy Easter weekend, and practice social distancing, wear a mask, and keep washing your hands. Thank you.